Hey everyone, welcome back. Hope it was a good little break. We have a fantastic speaker, Dr. Claire Hamlet. I'm just going to say that and she's going to introduce herself to you. So Claire, you can take it away.
Cool, great, thank you, Theo. Yeah, I just wanted to thank all the conference organisers and Theo for arranging this. I'm super excited to be able to share with you my presentation on why delivering trustworthy digital health experiences matters more than ever. And also it's been great hearing the other couple of talks, and I'm looking forward to all of the other talks that are coming up. So just a little bit about me. So I'm a user researcher and health psychologist, and I would say my work experience to date has been because I'm on a mission to empower people to live happier and healthier lives. So all of my roles so far, I'd say, have reflected my passion for psychology, healthcare and research. So I began in the NHS following graduation, where I worked as an assistant psychologist. I then came back to university to do an MSc a few years later. And after that, ended up working for the National Institute of Health Research, where I worked on dementia studies. I then became a fully fledged academic, I would say, and worked at the University of West of England at the Centre for Appearance Research for about 7 years, where I mainly conducted research on the psychological impact of living with various different health conditions that affect appearance or lead to disfigurement. And it was there that I did a doctorate in health psychology to become a qualified health psychologist. You might have seen me talk about this a little bit, maybe on LinkedIn. I know a few of you have commented on it, but I left academia in 2021 and pivoted to work in industry. And this was mainly because digital health was accelerating. I felt like health psychology had a lot to offer this field and it seemed interesting to me. So I've had the opportunity to work at two really fantastic startups so far. Scale-ups actually. First of all, Doctor Care Anywhere. So they are an online platform that provides the opportunity for consultations between patients and doctors. And I'm now working at ORCA, which stands for, we'll struggle to get this right, the Organisation for the Review of Care and Health Apps. So basically what we do is we review and accredit digital health solutions to make sure they're safe based on various standards such as safety, security, usability. And then once approved, we make these solutions available via two products that health professionals or patients can use to find and recommend safe digital health apps. So I'm sure we'll hear this a lot today, but in recent years, we have really seen a staggering growth in technology and innovation in healthcare. And this has really been accelerated by the pandemic. And obviously, this has a massive potential to transform and revolutionize the way we receive and kind of deliver healthcare services. So there's numerous benefits and opportunities. I've only mentioned 5 here, but I know there's many more. Feel free to drop those into the chat. But I think increased efficiency is one particular opportunity. We know that kind of the systems we can create can like save time, reduce administrative tasks. And I think of this section as actually making health professionals' lives easier and actually patients' lives easier when it comes to like having to book appointments or use systems to kind of navigate healthcare. Obviously, we've got the potential to really improve patient outcomes. It's something that I don't think has quite been realised right yet in digital health, and we've got a long way to go. But obviously, if digital health is realised and adopted, there's a real chance that we can improve things like making accurate diagnosis, providing personalised treatment plans, and getting better engagement, and then that will obviously lead to better outcomes. There's also a massive opportunity to save costs and I guess time as well. We know that NHS is really overburdened, kind of on its knees really, and digital health really has the opportunity to save money here. And also innovation. We know that, I guess, the reason why many of us are here today is because there are a lot of companies and a lot of organisations that are really pushing forward innovation in digital health and coming up with really exciting new kind of innovations. And then also we've got better access to care. So things like remote consultation accelerated during the pandemic and are still being used. And if we can reduce some of the barriers to in-person consultations, like if people are anxious, don't want to visit, or elderly, like digital health has the opportunity to provide better access to care in a way for those individuals. So in this presentation, I'm going to focus on trust between two sets of kind of users, and I might use the term users, so forgive me, I try and use patients and health professionals, but I do tend to default to users. So I'm going to focus on patients and health professionals, but I just wanted to spend some time kind of just highlighting some kind of subtle and some kind of major differences in the attitudes, demands and motivations for digital health between these two groups that I've experienced during research. So in terms of patients, we generally find that they're more accepting and interested in digital health, can be a bit more experimental, maybe a little bit more choosy about what they want to use. And really here, they tend to focus on convenience, accessibility and ease of use. I would say they really value good design and aesthetics, maybe a little bit more than health professionals, but it's still important for health professionals. They really look for familiar design patterns and experiences within their apps, and they're looking for kind of things to behave in the same way. Otherwise, they might kind of think, well, why is it doing that, or like make errors. And in my research, we've tended to put people into kind of two kind of, I guess archetypes of kind of users of digital health. And that tends to be those that use digital health solutions out of necessity or crisis, because they've had maybe a new diagnosis or they've got a new condition and they want quick help with it, and maybe in person isn't appropriate or available to them. Or you kind of get the people that are generally a bit more health conscious and kind of look to kind of monitor and track their health. And I guess, yeah, they have more time to explore and learn about apps and digital solutions. And actually, just to clarify, when I talk about digital health and my experience, I'm going to reflect mainly on health apps that patients use to make themselves better or get treatment or monitor. I'm going to talk about software as a solution, so health professionals using software to improve patient care, and also kind of virtual consultations. That's the experience I'm drawing on when I talk about this. And in terms of health professionals, I think they're sometimes a little bit more skeptical about digital health and maybe its potential. You do get people saying they recognize that it's, it needs to happen, that it's on its way, but they can't quite work out how to get it into care and can't think about a future where it's seamless. They really need solutions to save them time. Time and time again, I get people saying that they will not use a solution if it's, whether it's to recommend to a patient, whether it's to use as a kind of software, they need that solution to save them time, or if they're higher up, maybe demonstrate cost savings. Otherwise, they can't see why they would try, even if it's in the best interest of patients. It's really hard for them to integrate it into practice if it doesn't save them time because of the burden that I talked about before. They need to feel really confident in a product before they're recommended to a patient. So whereas patients may be more likely to experiment with it, health professionals don't have the time, but they need to feel confident in a product. And we come across this again and again in our work at Orca, and basically health professionals need to learn about that product before they feel confident recommending it to a patient or even using it themselves. Health professionals are sometimes forced to learn new technologies. So sometimes a new software is introduced and they have to learn it, which means that the solution needs to be user-friendly, intuitive. And they often prioritize clinical accuracy, data security, and regulatory compliance more than patients who might not be so aware of these issues or so worried about it. But across both of these groups, trust is key to the use and adoption of digital health solutions. And without trust, it is very unlikely either of these groups would use it or continue to use kind of a digital health solution. So just reflecting on trust a bit, I'm a psychologist, just take a little step back. So trust is a fundamental aspect of human relationships and really plays a crucial role in our well-being or social interactions. And psychologically speaking, trust refers to a person's willingness to kind of be vulnerable and rely on the actions, words, or decisions of another individual. And in everyday life, trust will appear in various forms. So we might be trusting our loved ones, might be trusting our secrets with them. We might trust strangers to do the right thing, follow social norms and, queue correctly or not hurt us. We trust our colleagues to complete their tasks properly. And we trust doctors with our health and well-being. But also trust is fragile and can be broken really easily. So it really needs to be nurtured and maintained. So why is trust important in healthcare? I mean, some of it might seem obvious, but basically trust promotes patient satisfaction, treatment adherence, and positive health outcomes. Basically, if people trust solutions or people or providers, they are going to have better health outcomes than if they don't. And it really is a fundamental component of the patient-provider relationship. When you think about it, if you've seen a doctor or GP or a certain clinician, you've had a really good experience with them, you kind of want to see them again because you've kind of built that trust. And patients that trust their healthcare providers are more likely to seek care and follow through with treatments. And also trust is really important because there is a unique vulnerability and unequal power dynamics that exist between healthcare professionals and patients when they are seeking to meet their healthcare needs. So trust is really essential to build here. And also research has shown that patients are more likely to trust healthcare providers who demonstrate competence, honesty and reliability, and really who involve them in decision making. No one wants to have decisions made without them. And if you can do that, that kind of helps to build trust. So really, all of those apply to digital health too. But I would argue that trust is even more important actually in digital health for the following reasons. So technology is really dealing with personal and sensitive information, and we're asking patients or even healthcare professionals to kind of hand over like personal and sensitive information about themselves or their patients. And so trust is really key there. Some solutions are often unknown, new or novel. So when we think about healthcare providers such as the NHS, we trust them. Well, we mostly trust them, but we know that they come from a good place and what they're about. And solutions or digital health technologies, a lot of us have no familiarity with them when we're being asked to use them. Trust is important because it increases patient engagement and adoption of the solution and therefore outcomes. If it's not used, you're not going to get the outcomes you need. And trust increases data sharing, leading the potential to lead to more personalised and effective treatments and care. When we think about big data and collecting human health data, we need people to enter this data and use these technologies to kind of realise the full potential of digital health in that way. And also, if a healthcare professional trusts a solution, they're more likely to integrate it into their practice. And I've seen this time and time again. You're not going to get a health professional integrating a solution into their practice that they don't trust because of their own professional kind of indemnity or risk management. They just need to trust it. And also investors are really looking for trusted health solutions. They want to invest in technologies that are being trusted by, the public, health professionals, and, they're not going to go and waste their money on stuff that they have no evidence that people are really trusting kind of this technology. So hopefully I've hammered home a bit there that trust is the backbone of any successful digital health solution. And it's really essential to kind of prioritise it from the very start. And actually failing to gain and maintain user trust can have consequences, I guess, beyond the kind of success of the solution itself. So it can impact patient outcomes. It can impact patient-provider relationships if someone doesn't trust the solution. And it also could affect the reputation of digital health solutions on kind of a micro level or a macro level. So someone might not trust the digital health solution itself, or they might not trust digital health as a whole if we get trust wrong. But I also think there is something a bit bigger at risk. I think if we don't make an opportunity to kind of prioritise trust in the design and development of digital health solutions, we will waste the most significant opportunity we have ever seen to kind of gain traction and make a difference with digital health solutions. So it can't afford to kind of be wasted. So in terms of how we can uncover trust issues in a solution, I think with many of the people here, this is no surprise, but it's through user research, because trust can really be nuanced and it's not always really obvious where and how trust might be an issue for a user. So I've had an experience where patients were not trusting of a solution just because it did not mention what would happen next, the next steps. So they just, because they didn't know what would happen, they kind of decided they didn't trust that solution. They didn't know what was happening. So, and I wouldn't have realized that if I hadn't taken people through usability testing and realized that we hadn't quite communicated that step right in the solution. So what we need to do is be gathering user research to identify any concerns or skepticisms about the product. You can analyze user behavior, look at product analytics, or for insights, aware barriers, where are people dropping off, where are people getting stuck. You can look at feedback and reviews from as many sources as possible. So for more established kind of apps or solutions, you can look at app stores, social medias, or review pages. And it's really important to stay on top of industry trends, the news and regulation changes, because sometimes external factors may contribute to distress. We've all heard of I won't name some of the technologies that have kind of been in the media or news for kind of breaking rules or selling data, etc. And that is going to undermine kind of trust. So you want to kind of keep on top of that so you can address it in your solution if needed. And also, it's just really important to stay in constant engagement and conversations with healthcare professionals and providers, and also kind of users. So just that constant like feedback. So I'm going to go on now just to talk a little bit more about what factors erode trust in digital health and how can these be addressed. And this is based on my own reflections from user research. I'm sure many of you will resonate with these. And also, I haven't been able to talk about every single one because I'll be here all day. So feel free, if I've missed anything or missed anything that you think is interesting, drop it into the chat. But yeah, this is based on my own personal user research that I've been conducting, I'll say, over the last 8 years in what can erode trust. So first of all, a lack of transparency can really negatively impact trust. So patients and healthcare professionals really want clear and upfront information about the product and its history, so they can trust the motivations behind it. So I've had lots of questions, and we know as user researchers, you're not meant to give the answers to these questions, but a lot of these questions come out of people just not understanding the app enough. So I've had, who created this? I don't know why it was created. I don't know why I would use this. What benefit is it going to give me? Have health professionals been involved in its creation? Like, you know, is it based on evidence? Is it actually effective? I've had people ask, because it's not explained well enough, why do you need this information at this point? What are you going to do with that information? They also want to know how much it costs and are skeptical if it's free. And also, what does that word, sentence and paragraph mean? We know healthcare and the NHS are particularly bad at using acronyms or kind of jargon. So obviously that can be an issue in terms of trust. So in terms of being more transparent, it's really important to clearly state why the solution was created, what pain point or need it arose from. And this is even more important if it's not obvious. Sometimes there are healthcare solutions that we know are needed, but sometimes it's not quite clear when you log on why it's needed. And it's just sometimes good to, well, it is good to explain why. Also to say who created it and what is their background, and balance app. So during this presentation, I'll bring up a few examples that I've been managing to find within the time. But Balance app does this really well because it says what it does. It says how it can be used. It mentions that experts are involved. It gives you a little snapshot, but then allows you to learn more if you kind of want to learn more about the app. And the person on the bottom right hand side, Dr. Newson, is the person that developed it, and she's kind of really introduced really well, and you know that she's a GP, etc. And this kind of gives people a lot more trust in the reason as to why kind of an app has been developed. It's really important to display clear and concise privacy policies. Explain why certain information is needed. So just give an explanation. You know, we need this information so that we can, if it's free, say so. If not, say how much. I've had apps when I've been doing competitor analysis that are actually free, and people just suspicious that they are free, and then sometimes just abandon them because actually, if they don't know that it's free, sometimes they don't trust that it's free, if that makes sense. Probably not making very much sense there. And if it's not free, just say how much and at what point. I've had some situations in competitor analysis where I've witnessed patients going through a process. These aren't patients with any kind of condition, they were screened out for that. But even so, they're going through a process where they are kind of giving information about anxiety, depression, etc., in order that they think to get support. They've gone through that, kind of invest that emotional energy, and then all of a sudden they get a paywall where they have to kind of pay more money to get the solution that they thought they were going to get at the beginning. And kind of, I think that is ethically kind of really dangerous, and that's not, I wouldn't want to really work for a solution that kind of did that. And also it's really important to avoid complicated language or acronyms, as I touched on before. So another thing that I've experienced is that patients, and in some ways health professionals, but not so much, mainly patients, do not want a one-size-fits-all when it comes to digital health solutions. So personalisation refers to the ability of the solution to cater to an individual's needs and preferences. And when a solution really fails to deliver this level of personalisation, you kind of get this sense of disconnect between the user and the solution itself, which can then lead to this mistrust. And patients are becoming more savvy. There's a lot more digital health apps. I think in 2021, there was 350,000 digital health solutions available to patients to download. So they're experiencing kind of apps much more, and they expect them to really be tailored to their individual needs and preferences. And psychologically, this also makes them feel heard if it's tailored. You don't want something that you feel is generic and being given to everybody. And solutions really need to be able to understand patients' unique needs and meet them where they are in terms of their health. So really connect and kind of meet them where they are, and then provide the support and help that they need. So there's different ways that I've seen personalisation to be enhanced. I think using an individual's first name and using conversational and familiar language. So you can see on the right-hand side here, Karma's a good example where they're kind of asking for people's goals so they can personalize. They actually use that word, recommendations based on that. And that kind of makes you feel like the app is listening to you like a healthcare professional was, and then is giving you what you need. And yeah, so it's really important for apps to tailor content by understanding users' motivations, goals, or pain points. Just ask the relevant questions. And that's if required. I know not all digital health apps need to be personalized. You know, some things like a blood pressure monitor blood pressure like record might not need, because it's just data input, but you still might want to be able to allow people to customize it, or, you know, have a name there, or at least know that, you know, that it's personalized to them as well. And also allow users to personalize the look and feel of a solution. I think we all know that some health apps will allow us to do that, allow us to remove certain things, allow us to change names, labels, etc. So allowing that can help lead to things feeling more personalized. And also kind of having personalized recommendations in a dashboard, like you can see on the right-hand side, where it's clear that that is your data that you can see. And that kind of helps you feel kind of more engaged. And I trust that app is actually recording and listening and kind of tailoring content based on your kind of health status and needs. And this won't be a surprise to any of you here, I guess, being UX kind of professionals, but a poor design and user interface can really break trust. So it makes users more likely to question a solution's credibility and professionalism, and they're less likely to trust a solution with their health and personal information. And one of the things we do at Orca is when we have our app libraries that health professionals and patients can, you know, kind of browse digital health apps. One of the things they want to see is the design, like a snapshot of the design. And when you probe why, it's got nothing to do with, oh, does it look pretty? It's like, is this credible? I want to know that this is well designed. When you probe further, I want to know it's well designed, because then I trust that it's, I guess what would I say, is the kind of right. They want to make sure that it's, I can't think of the right word there. Yeah, I guess it's all about credibility there. And I'm not going to go in on how we can improve design and user interface. I guess, you know, I think we know how to do that, and the designers know more about that than I do. So the fourth thing that can erode trust, and this comes up time and time again, I don't know how many times I've said it to various companies and in my research, but social proof basically refers to the influence that the actions and opinions of others can have on our own behaviour and decision making. And it is essential for building trust and increasing the adoption of digital health solutions. So this is where you're really looking towards others and what they're doing and whether they've used it and things like that. So there's various ways you can demonstrate social proof, and you can do this in really fun ways. It's one of my most favourite ways to kind of think about how to kind of get this into products. But you can use reviews and ratings from users. You can see on the bottom right-hand side where you've got the App Store rating kind of visible. You can use testimonials, whether that's from patients or health professional users. You can display the number of users. Headspace does this really well, kind of the number of Headspaces meditating right now. You can report case studies, how this is being used in practice or on the ground in kind of healthcare organisations. You can use professional endorsement or collaboration to say that other people kind of validate that this is, you know, a trusted solution. And also kind of, I found that those stamps of approval, kind of, you know, used by the NHS or recommended by the Royal College of Psychiatrists or something, really helps people to feel like, oh, other organisations trust this and I can too. I think this is something that every kind of digital health solution can do in some way or another and needs to. Another kind of barrier to gaining trust is there being no opportunities to provide feedback or receive support. So the ability to provide feedback or get support if needed can really help users kind of feel supported and engaged with solutions. If they can't, they may assume the solution is not interested in their opinions or experiences, feel out of control, and question the motives behind the app. I'm sure we've all had an experience. When it comes to mind, it's always the kind of telecom providers, I won't mention their names, where you're trying to get support or get a better deal and you just can't get and speak to the right person, and you kind of feel out of control and frustrated with that. You can't provide feedback. You kind of feel a bit lost. And when you think about healthcare, and if you're in a vulnerable situation, how worse you feel then, especially if it's kind of, a critical health condition. And any feelings of frustration or issues going unresolved will result in a negative experience, and then it'll be less likely that you'll trust that solution again. I'm sure we've all got in our minds ideas of companies that we've had a bad experience and we think we will not use them again. I don't trust them. So this is why it's so important to get trust kind of early on in digital health solutions. So in that way, it's really important that we provide opportunities for users to provide feedback and receive support at every opportunity. And these need to be accessible. So, whether that's email, chat or phone, just provide ways that users can get support. Kind of in-product surveys and pop-ups, a pop-up to where you can provide feedback, really show to kind of users that we are listening to them, that we want their feedback. And then kind of even provide an opportunity to participate in user research. I really notice this now being a user researcher, but when companies offer you the chance to get involved in research, you think, oh, they're actually trying to do things better. And you kind of trust them a bit more on kind of their motives in that way. And then it's really important to close the feedback loop. And I see this quite often when health professionals provide feedback on solutions. They really want to know that their feedback is going to be listened to. So it's really important to kind of close that feedback loop and feedback when you've made changes to the product. So we've done things like you said we did, kind of bulletins, when we've done product updates and releases. And also you can get them involved in co-design, mention the problem that people are reporting and get them involved in thinking about the solution. And that can really make people feel kind of more engaged and trusting of that solution. So another key issue, and this is mainly for healthcare professionals. I haven't come across it that much with patients, but obviously patients are healthcare professionals too. Some of these will be looking for this. But a lot of health apps or solutions or software fail to demonstrate and communicate the effectiveness. So, that this solution actually works and actually leads to kind of a desirable outcome. So healthcare professionals and providers want to know that the technology they're using or recommending is reliable, safe and effective. And if they can hear that the solution is evidence-based or it's been researched thoroughly, this is going to relieve any kind of concerns of harm to their patients or their own reputation. So I've been taught as a health professional, and many other health professionals are taught to be evidence-based. So the drugs or therapies or techniques they use, they are to be evidence-based. You would not use them if they're not evidence-based. So when they're looking to use or recommend digital health apps, they're looking for the same situation. And I found solutions are really bad at just communicating that. If they do communicate research, it can be really difficult to understand, or it's not done in quite the right way. And I think we need to get really better at doing this. And I know that will become a thing in the future where digital, the patient outcomes with digital health is going to be even more kind of scrutinized, especially if we want it to be adopted and used by the NHS. So in terms of demonstrating effectiveness, conduct as much research on the solution as possible and focus on patient outcomes. Sometimes it is really hard to measure them, but solutions need to start making an investment in this, otherwise they're going to be kind of left behind. And Sleepio on the right hand side, some of you might be aware that in May 2022, it's kind of a monumental kind of moment for digital therapeutics. As NICE actually recommended Sleepio as kind of cost-effective treatment option for people with insomnia, and that was based on the research that they had done showing that it was effective. And that was the first ever kind of digital therapeutic to receive that. And that they really clearly demonstrate that on their website and make it really accessible actually for anyone to understand. And WISA also do the same on their website. If you go on, you can kind of look at the research. They give a snapshot, but you can dig more into that. So just making the research really visible and available to health professionals on the website or the actual solution itself is really important. Also, if there's any way that solutions can demonstrate cost effectiveness, whether that's appointments saved or appointments attended or time saved, just kind of that information that NHS would be looking for. And also, it's really important to contribute these findings to the academic literature. We need to get much better at digital health solutions at kind of doing the research and getting it out there. It's not just academics sitting in universities that need to be doing this. And Orca does this actually really well. And also, we need to make all of this information easily accessible, like I said before. So I don't know what time we're on now, but actually, I can't see. So hopefully I haven't whizzed through this too quickly. But in summary, building and not losing trust matters more than ever due to the potential of digital for transforming healthcare. Patient health professionals' needs and motivations for digital health may differ, but trust is really key for both. And innovators have got to, product teams and, UX people really focus on trust in the design and development of digital health, and really keep focused on it. It's not something you do at the beginning and then leave. You really need to like keep up to date with kind of trust. And it is nuanced, and it's only going to be identified through user research, which is essential, as we know, and especially as it's really not always like easy to identify unless you're doing that kind of in-depth research. And trust needs to be gained, then nurtured and maintained, like I've said before. And I just want to finish on this. So, we hear this a lot in kind of digital health in startups that, you want to move fast and break things and learn. But this approach that may work in tech does not translate well to trust in digital health, where I would say that trust cannot be broken at all. So, thank you for listening. And I'll end there.
Thank you very much there, Claire. We really appreciate that. Very insightful. So we have 2 questions here. And the first one I want to start off with is, do you find in your sort of professional opinion and obviously dealing with users like COVID's affected the trust RE apps in healthcare?
I would say, I'm not sure how much it's affected it negatively. I would say that, the pandemic made us kind of use some health apps. Like it all seems a little bit of a blur now, but the NHS COVID apps, which might, not have been the best apps, but we were forced to not forced to use them, but we were required to use them. We did it for kind of social good. We also started using kind of online consultations as a way to communicate with our healthcare providers. So that's kind of, really started to get us more used to digital health. I wouldn't say it's necessarily increased the trust, it's increased the acceptability, which then will more likely lead to trust as it goes on. But I guess I have heard people talk about, the difficulties of some of the NHS apps and stuff that maybe are not the most user-friendly, but I guess because it was an organisation, a trusted organisation, people trusted it. So, so I would say it's have an impact, but I think now is where we need to kind of start building that trust and maintaining it on that back of that momentum.
Good answer. Thank you. I just had Jasmine just say thank you, Claire. I was nodding along throughout. So
that's good.
Good. So the next question is from Grace. Just to add to reasons for lack of trust, is negative stereotyping created by ineffective UX tools such as proto personas, which may lead to lack of personalizations mentioned by Dr. Claire?
Yeah, so I think that's like Hayden said before. Yeah, if you've got a persona that's not quite got the not nail on the head is not the right word, but not quite got to the right point and the crux of kind of the needs and pain points, then you're not going to develop a solution that's going to address those pain points. And again, that all relates to trust. Like you're not listening to me. So I agree.
Totally. Okay. Thank you very much. And that is it. Cool. So if we can just give Claire a huge round of applause in the chat section, that'd be great.
Thank you.
Just thank you, everyone.